Sleep is actually one of the number one factors for why someone could be pre-diabetic. You're basically cheating your body for being able to have the best process of regulation. We were not meant to be alone. God didn't create us to be alone. We need people, we need community, and we need to build with each other. Please do not be afraid to vocalize what you're feeling. There's somebody out there that is willing to listen.
All right, y'all. Welcome back to another episode, man. Listen, first of all, I appreciate you. If you are a new listener, so you have never listened to our podcast before, I want to thank you for being here. I want to thank you from the bottom of my heart for actually taking the time to click on this video, click on this episode, and to listen. If somebody shared this with you and told you to listen or watch, that means that they think that you're someone that takes your health and your wellness and your well-being seriously. If you're a Black man, that means that there's someone that actually really messes with you, that thinks you're dope, that wants to see you win. And we want to see you win as well, right? That is our motto here at Express Yourself Black Man. On top of leading with vulnerability, we want to make sure that Black men are able to win. If you're a Black woman and this is the first time that you're listening to this episode, we want you to know that we welcome you here. This is not a space where you are going to feel excluded from the conversation. This is not a space where you're going to be bashed. This is a space where you can really understand us more as Black men so that you can be able to help the Black men in your life. And if you are a existing listener, you've listened to previous episodes, you've been following the podcast for a while, again, I want to say thank you so much. We don't get to where we are right now without people like you. And so I'm very, very grateful. I take this very, very seriously. The goal is to improve the Black community. And with that being said, we have a doctor in the building, a young doctor in the building, Dr. Michael Forde, who is doing just that, right? And so we want to have a conversation about health and wellness. We want to talk about the Black community. We want to talk about Black men. And so we thought, who better than Dr. Michael Forde? But before we get into that conversation, we have to ask, Dr. Michael, how you doing, brother?
I'm doing good, man.
Good?
I'm feeling too blessed to be stressed.
Too blessed to be stressed.
Blessed to be stressed.
Listen, man, I love it. We were having a great conversation offline, behind the scenes, about all the dope things that you're doing, the collaborations and everything, man. And so I'm a supporter of what you're doing. I believe in what you're doing. And so that's why you're here. And so I want to start the conversation, man, by just asking you, why do we as Black men not trust the healthcare system? Because I feel like there's a lot of discourse around like us not going to the doctor and not taking care of ourselves. But there isn't a lot of discourse on like why that's the case. So where do you feel like that comes from and why is that the case in the first place?
So a lot of the context for why Black men don't trust the doctor or the healthcare system in general, it starts with a lot of historical trauma. So you look at how Black men went through the Tuskegee study, where the United States Public Health Service had to not tell the truth about how Black men really went through the study, and they had syphilis going on throughout the course of the study. Or you think about historical context, even from how Black men were treated in the Jim Crow era with segregation in hospital systems, and how doctors have treated certain patients with biases. These biases still exist today, and there are a lot of biases in hospital systems with algorithms and patient-centered care that's not so patient-centered for the Black man. So Black men don't know who to trust. And this is a historical context that has been passed down from generation to generation. And so a lot of the reasons why really just is history. History tells a valid point into why we're not as vocal and trustworthy of the doctors.
Right. And do you feel like that's something that we're still like dealing with today as far as like medical gaslighting? Because I know that that's a term that I've seen before. I think you have you used that? Yeah. So like what is first of all, what is medical gaslighting before we even get into this?
So let's talk about it. So medical gaslighting is this idea that I'm essentially telling you that there's nothing wrong with you, even though there could be something wrong with you. You come to me, you come to any healthcare practice, you come to any organization and say, hey, I'm not feeling well. Mm-hmm. Your symptoms now become diminished.
Right.
I can tell a quick story where an individual, Black male, went into a hospital and he reported shortness of breath. He wasn't feeling too well. Doctor looked at the individual and said, hey, you again? You don't need to be here. You always come. The truth of the matter, this individual had a health situation that required some treatment and some checking up upon. But when symptoms are diminished, worse outcomes can happen. And so we have to make sure that this medical gaslighting phrase and terminology really gets addressed, and the elephant in the room is you cannot diminish the symptoms with people.
And, when I think about medical gaslighting, I think about black men, but what I think about more often than not is black women. So can you explain, first of all, do you understand why I'm saying that?
Sure.
Yeah.
Explain, talk, break it down.
Okay, right? So when I think about medical gaslighting, I've heard so many black women talk about how sometimes they'll go into the doctor and they will have some type of ailment, some type of thing going on.
Right.
And their doctor will just not be sympathetic to it, not understand it, or just, again, diminish it for whatever reason, right? And I think we all know what the reason is. Yes, but they will not actually give it the care and attention to detail that it deserves. And so, like you talked about, it can lead to worse outcomes. I find that for black women that are actually health conscious, it takes them more, it takes a lot more for them to actually find a doctor that can actually treat whatever it is that they have going on.
Right.
Because a lot of doctors, if they don't look like they have anything wrong, right? Like, let's say they're not overweight or there's nothing really showing physically that there's something wrong, then a lot of doctors will be like, oh, you're fine. There's nothing to worry about. Just keep going on with what you have going on. Right. So, and I feel like a lot of, again, black women are very intuitive. And so they know when, that's not really making sense. Like, I actually have something going on internally. And so it takes them a lot longer for them to actually get the help and care that they need. And so I just want to bring that to light, because I have a lot of black women in my life that I feel like have had to deal with that in one way or another, like that medical gaslighting. So to bring it back to black men, how would you suggest, or just black people in general, how would you suggest we navigate that when we're going through that? Or are there some things that we can do when we feel like we're not getting the outcome or the treatment that we deserve in these spaces?
For sure. So the number one thing I would say is be the best advocate for yourself as possible. Self-advocacy is the strongest tool, because you are vocalizing what you believe, what you feel, what you resonate with. A lot of times people have the fear of advocacy because they don't want to be looked at as someone who is trying to, be a problem, so to speak. But there's power in advocating for yourself. And if you don't feel like you can be strong enough to advocate for yourself, find people to put them in your circle that can advocate for you, especially when you are in a health situation or maybe on the brink of one. And the second thing I would say is to make sure that you stay well informed. Right. So part of being well informed is not just, being able to advocate for yourself or having the right information in your pocket about what the health information or the health issue that you're going through is, but also making sure, do you know if there are any doctors that look like you? Do you know if there are any culturally appropriate centers that can take care of you?
Yeah.
Do you know if there are any organizations or systems that have ratings that align with the outcomes that you're looking for specific to your illness? And I say this all the time. Equity has to be the center of all these pieces, where when you talk about equity, it's, do I get the care that is meant for me?
Yeah.
Right? Because the truth of the matter is, as a black man, we have so many brothers across the world, and they can go through the same health issue, but all need different avenues and treatments based on who they are.
Yeah.
So when you wrap it up, I'd say advocacy, make sure you're well informed, and then making sure that you can bring it all together by searching for the most equitable system that can take care of you.
Yeah. And you know what's so interesting? I'm so glad you're talking about advocacy, man. You talked about self-advocacy, but you also talked about having people around you if you can't or don't feel comfortable or you're not able to advocate for yourself, having the right people around you.
Right.
One of the situations that I think about, again, I'm, bringing it back to black women, but for good reason. One of the situations that I think about that I'm not terrified about, but I'm very aware of is black women and their maternal.
Yeah.
Right?
Yeah.
And just knowing how I've seen so much like conversation online about how like when Black women go through pregnancy, how they get treated differently. Right? Like how they may not get the same treatment. They may not get the same care. Right. They may not get the same, again, attention to detail when it comes to how their pregnancy is managed. And so it's important to have whoever, their partner or family, a support system in the room that can actually advocate on their behalf where they're not able to. Right. Because these people sometimes will try to play with you. You know what I'm saying? And like, I think about my fiance, and I think about having a child with her, which I definitely want to do. And I'm not having that game. I'm not playing that game. You know, we're not playing the game of like, I know she wants a certain thing, but you're telling her like, nah, don't do that. You're not able to like, we're not playing that game. We're not cutting things early. You know what I'm saying? We're not ripping babies from hands. We're not doing any of that because again, and I think to add to that, like you also have to be on par or just understanding of what your partner wants and needs. Right. So you got to be very involved in the process, which I plan on being. Like, got to be very involved in the process. All right, babe. Like before we even get to like a crisis scenario, we got to be planning for the scenario. What is it that you want if this and this were to go down? Like, if you're not able to push, do you want to do a C-section? Do you want to even have that as an opportunity? Do you want to take medication when it comes time for you to go through labor? Like, are these things that you're actually interested in, or do you want to actually go the other route? Because that also plays a role in how I show up now. Like now when they offer certain options and I know she's not interested in that, I'm like, yo, let's not even talk about that again. Right. Because if you're offering it multiple times, that's also a stressor on her. Right. She's already made a decision from prior. Like, so all these things are very, very important for you to be cognizant of as the person, like the partner, when I'm thinking about pregnancy, as the partner, you have to be cognizant of all these things because sometimes like, well, I think I would say a lot of the times, like whoever's delivering the baby, having the baby is under a lot of stress. They don't have time to be thinking about like, oh, damn, I got to do this. They're thinking about delivering a baby. Right. So you got to be there to advocate on their behalf. So like, I think about that a lot, man. So I'm glad you're talking about the advocacy part because I think that's one part that like, if there's anything that we can do when it comes to health outcomes for Black women, when it comes to maternal health, at least is that advocate in the room. And you're not going to tell me that I can't say what I need to say when it comes time for the baby that I helped to procreate to be delivered. Like, nah,
I'm gonna just take a moment to jump right in and just say advocacy is such an important tool that we sometimes don't use enough. Mm-hmm. Because as you're saying, using your voice, letting it matter. Yeah. Our voices do matter. It's through our voices that change can occur. Right. So if we stay silent, change will not happen the way we want it to happen. And also to that point, if a provider is not listening to you, please go to another provider. Yeah. That's something that people don't always think about. Yeah. Because they say, well, I'm here already. If you're talking about maternal mortality, the risk is much higher for Black women than white women. Not even to get into the data, I can go deep, but it's not looking good. Yeah. And it is okay to have a doula, a midwife. It's okay for Black women to have that support circle, but for Black men as well. Yeah. And especially, you talk about wanting to have a child one day. I want to have a child one day myself. And I know, like, as a future father that I'm going to be, I have to advocate for my wife when she can't advocate for herself. Yeah. And as a Black man, I have to make sure that I embrace this concept of advocacy now so that later I'm not new to it. Right. I'm used to it. Yeah. Right? Yeah. So just to piggyback on that, the importance of advocacy, it's something that we have to see. Yeah. And in our Black community, it really means asking the right questions, showing up to different community, events, organizations, or conversations that can allow for more building and just to make sure that you're present as much as you can. Yeah. Because change won't happen if you're not willing to say something. Yeah. And I think sometimes we're afraid. Right. And I know Black men don't want to have this conversation. But I'm going to be honest, bro. Like, this is the platform. I feel like sometimes we're afraid of speaking up. Right. Because of the fear of like what people will perceive about us. Mm-hmm. We're already covered in so many different stereotypes. So it's like,
I'm worried that if I speak up and say something, they'll perceive me a certain way. I've had to get to a point where I'm comfortable if I fulfill a certain stereotype. If you cross me or you cross someone that I love and I care about, I'm comfortable fulfilling a certain stereotype to advocate for myself or for them.
Right.
So if I'm going to be the angry black man in this situation where they're saying, oh, that guy is ghetto, so be it.
Right.
Because at this point in time, I have to advocate for myself because you disrespected me or you're not listening.
Right.
And now you're potentially putting me or someone that I love in harm's way. So now I have to advocate for myself. I can't be worried about people's perceptions of me when it comes time for me to advocate, right? And so I think sometimes that can be a thought process that we have is like, damn, like if I say something like, perfect example, like you at a restaurant, right?
Okay.
And I hear men talk about this all the time. I hear men and women, whoever, talk about this all the time, right? You're at a restaurant. You order something, you got it. Okay. It's not really what you want. You took a bite out of it and you're not really feeling it. Now, do you advocate for yourself and say, yo, listen, this isn't what I want. Can I get something else? Or do you just deal with it because you're like, yo, listen, I don't want to be that person.
Right.
You got to be comfortable. Like, and I know sometimes we have a partner that feels comfortable advocating for ourselves. So a lot of people will like there's one person in a relationship that really doesn't do that normally. And then there's another person that normally fulfills that role.
A lot more, yeah.
Perfectly cool. But when you're in a position where you're the person that normally doesn't do that and the person that normally fulfills that role isn't able to do that, you have to be able to assume the role.
That's the point.
You get what I'm saying? Yes. You have to be able to assume the role because you don't want to be in a position, again, where now your partner's life is on the line or your child's life is on the line and you're not able to speak up and use your voice because you're worried about people's perception. Nah, we can't be worried about that. Right. So one challenge that I would give is for someone that if they feel uncomfortable speaking up and advocating, when you're in a restaurant, if you get something that you don't like, try advocating there. Like this is a very low risk environment.
Low risk.
And it will teach you like, okay, cool. People will deal with it. Right. People will get over it. And I will actually get the outcome that I want. Or if I don't get the outcome that I want, I'm able to move and leave and move with that information rather than sitting in a specific environment and situation that I'm not really feeling comfortable with, you know? Right. So like,
correct.
I've had to really get comfortable with like, being okay with being the stereotypical angry black man and just being okay with that. Because again, like if it's time for me to advocate, for someone that I care about or for myself, I have to be comfortable doing that. I cannot allow people's perceptions of me to change how I show up for myself. Because again, at that point, then now I'm making myself unhappy to make people around me that I don't even know comfortable and happy. You know what I'm saying? Oh,
those are ours, man.
Listen, bro. I want
much needed. That was much needed info.
Nah,
sometimes it's the small things that you can do to be prepared for the bigger picture. I think that was really important. I'm sorry.
No, you good. Go ahead.
The restaurant example was such a powerful thing because if you think about it, a lot of what we do every day is habit. It's habitual. We're used to it. Habitual, right? Mm-hmm. But small habits can create bigger outcomes. Mm-hmm. So if I'm practicing advocacy in a small way, as you said, restaurant order is not the right one.
Yeah.
How do I then, maybe I'm not used to speaking up for myself. Maybe I've never spoken up for myself before. Yeah. I take advantage of that opportunity. Okay. The more times you practice that, someone cut you off in a shopping line. Can you address it? Maybe you can still address them in a respectful way. Yeah. Or can you still address the situation? Or are you just going to be silent and then you're going to end up being the person that always says, it's not a big deal.
Yeah.
And then you get so used to everything not being a big deal that you'll never know when to advocate for yourself. Yeah. By the time it's necessary, it's too late.
Yeah. So, no, that's a fact. No, it is a big deal. So it is a big deal. It's always a big deal.
Right.
Because if it makes you feel uncomfortable, then it's a big deal. Why do you need to be uncomfortable when somebody else is comfortable? Somebody else literally stepped on your comfort to be comfortable. Like if we're talking about the line example, right? Like again.
Yeah.
Sure, in the grand scheme of things, maybe you wait 5-10 extra minutes. Okay. In the grand scheme of things, it's not a big deal. Right. In that moment, it is a big deal.
Correct.
It is a big deal. Why did you skip me? Correct. Why did you even feel comfortable skipping me? Why do you feel like why am I so invisible to you that you didn't even notice that I was in this line? These are the questions that go through my head. I have to say something.
Right.
Yo, bro, you know the line starts back here, right?
Right.
And that's all you got to do. Yo, bro, you know the line starts back here. And now if you knew and this is how you move, now we having a different conversation. But now at least I have the information to move rather than me sitting there being upset and then you move like, nah, we ain't doing that. And we ain't doing that.
And here's the thing, just to piggyback off what you're saying, right?
Right. Mm-hmm.
It matters even so much more for health.
Right.
Because this is actually the thing that is you.
Right.
You are the best advocate for your own health. I'm sorry. The doctors might be mad at me for saying the clinicians might, but you are the best advocate. Yeah. Because only you know what's really going on in the sense of you can feel it. Yeah. You know what you might not know how to describe your symptoms in the medical jargon, but you know what you're feeling and experiencing. And the doctor might have everything, from like explaining the labs, explaining, the projection of the care for the patient. But you saying, doctor, I hear you, but I'd also like to add this. You have to be willing to do that. Right. If, as I go back to it again, if the doctor does not say, I can listen to you, you may have to figure out who else can.
All right, I'm interrupting this podcast episode to let you guys know to leave a review on the podcast. Please, 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 if you are listening to this episode and you're finding value in this episode, you're enjoying the conversation, or you've enjoyed a previous episode or conversation, and it's safe to operate your phone right now, please leave us a review. Your review is a free and easy way to support us, and it helps us reach more people like you. We're on a mission to build a stronger, more connected Black community, starting with Black men. And you can help us on that mission by taking a minute out of your day to leave a review. Your review helps us generate more listeners, which in turn generates more revenue, allowing us to expand the platform even further. So please take a few seconds out of your day. I know you're busy. I understand. I know you're doing a lot, but it will help us greatly if you would just take a few seconds out of your day to leave a review right now. Did you leave a review yet? All right, let's get back to the episode. I want to pivot a little bit. I want to ask you, what do you feel like are some myths, though, that we adhere to in the Black community, specifically for us as Black men when it comes to our health?
So the first one, the major one, is I am strong enough to handle this all by myself. So how that relates to health is, let's say you're sick, come down with a common cold, right? This is a story I'm going to tell. Come down with a common cold, and then it turns out that's not a cold. It's actually maybe an infection, viral, or something that's a little bit more serious. You might say, oh, I got it. Your wife, your girlfriend, brother comes to you, hey, you should check this out. No, I got it. I'm good. I don't need help. Well, unless you've been to the doctor. I don't go to the doctor. I don't need help. I'm good. I got it all on my own. Do you want to talk to anybody about it? No. I'm good. And I have so many uncles, family members, people that I know in my life who this is their MO. The problem with that is we do need help. We do need to be listened to. We do need people to pour into us to help us build to a place where we can have a better health outcome. It's so often that Black men feel that they can do everything on their own. And rightfully so, in a sense, because that is what society has, quote unquote, built for us. The feeling that we are to be the providers, we are to be the protectors, we are to be the leaders and the people that have it all together. But who do we go to when we have it all together? When we are the provider, when we are the protector, we have to go to someone. And this is where the myth is that you're so strong that you don't have to go to anybody.
Right.
The problem is strong people still go to others to continue to be strong. It's not to say that you're not strong for, being ill or being sick or going to the doctor makes you any less of, a man. Not at all. In actuality, I would challenge anybody who says that and thinks that and say, actually going to the doctor makes you more of a man because you're taking control of your own health.
Right.
Why would am I in control? Am I truly in control if I don't advocate or take care of my health?
Yeah.
If I'm just going on the everyday and just letting things happen to me without really taking control and just letting it be, is letting things be being in control?
Also on top of that, right? Like if you don't know what's going on with you, how can you control what you don't know?
Right.
Right? Like I always say this when it comes to leadership, because we always talk about leadership on this platform, and just like being a leader as a man. You have to have information.
Yes.
You can't lead what you don't know. So how are you in control of yourself? How are you leading yourself effectively?
Right.
If you don't know what's going on with you. And I think the problem is a lot of times we assume that we know because there's not anything physically showing up. So what would you say to the black man right now that doesn't have anything physically like showing up for him and doesn't feel like he needs to go to the doctor? There's a lot of us out here that's like, yo, man, I'm good, bro. I still know I can still jog. Ain't nothing wrong with me, bro.
Listen. So building off of what we said before, let me tell you, there are so many invisible illnesses that you don't see the complications right away until something gets really bad. High blood pressure, that's what we call the silent killer. In healthcare, you see that high blood pressure doesn't really have a lot of symptoms. It's not like the common illness where you can see things coming and building up to, oh, he has high blood pressure coming down the way. It just kind of hits. And then you also have things like diabetes. You have, the necessity for us to check labs and check our blood sugar levels, but sometimes we don't do that. So building off what you said, it's like we have to understand that a lot of the silent illnesses may still exist, and we feel like we're good because we're running, we're jogging, we're working out in the gym. And I'll be vulnerable right now.
Yeah.
I went to the doctor about 2 weeks ago. I'm pre-diabetic.
Okay.
So I'm pre-diabetic. So my A1C levels are a little higher than normal and kind of on the cusp of what the diabetic level would be.
Yeah.
Now, immediately, I'm like, listen, when I tell you I try to do everything right, I eat my fruits and my veggies, I drink my water, I stay hydrated, I run, I work out like 4 times a week, if not 5, depending on the day. But I try to do everything right, and still here I am as a black man, pre-diabetic.
How? That's all I was gonna ask you. How?
And when I tell you, I was in denial the moment I looked at the labs, and my wife is also a physician. Shout out to my wife. She's a pulmonary critical care physician, Dr. Chelsea.
2 doctors.
Hey. But, I had her come into my office and look at the labs with me. And I'm like, this doesn't make sense because I've done it all right. And this is where everything I've said up to now is like, okay, how do I take control? Because now I have some information to work with. Right. So I automatically knew, I know what the physician is going to tell me. Watch what you eat. All right. Watch those sugars. Make sure that you're 3 times a week, you're getting your cardio in. Are you drinking enough water? Are you getting enough sleep? And also to any black man listening to this, sleep is something that y'all gotta get.
Yo.
And I've been going to bed every night at like 1:30, 2 o'clock in the morning for the past, I don't know, 3 months. I'm always working on a little something, whether it's for media, for work. And sometimes I'm not even working. I'll just be real. I'm just chilling.
That's your circadian rhythm
That's my circadian rhythm. The problem is I wake up at 6:30.
Yeah, so you only get 4 to 5 hours.
If that. And so,
you know what's so crazy? Most black men probably are doing that right now and think, man, 5 hours is optimal sleep. No, you're probably sleep deprived.
And let me tell you something. Sleep is actually one of the number one factors for why someone can be pre-diabetic.
Really? Sleep?
Sleep. Because when you don't get enough sleep, in other words, you're basically cheating your body for being able to have the best process of regulation. Let's just put it like that.
Okay, explain that to me.
When you don't get enough sleep, and drink enough water and all the things that I mentioned, your body over time says, yo, Mike, you're killing me slowly. All right? And your sugars, that could be broken down with regulation, I can't function the way that I'm supposed to.
Yeah.
So that late night snack you just had and you're still up, guess what? Your blood sugar levels are more likely to be high because you're having that late night snack.
Yeah.
And I can't really work to break things down the way I'm supposed to because you're not sleeping. You're not sleeping.
So now you're holding on to sugars for longer.
And you're holding on to things, and there's a lot of data and research, so I always challenge people, don't just listen to what I say.
Yeah.
I'm just the vessel. Go to PubMed, go to journals, go to Google Scholar, start there. And look, there are studies that literally link lack of sleep to having correlation to high blood sugar levels. And so I just sat with this information shocked, and I'm like, how do I change this?
Right.
And the thing is, it's not easy to change.
Yeah, it's not.
It's not easy to change because you're used to a certain rhythm, you're used to a certain flow. Even now, I'm still struggling to get to where I really should be in bed by 10 p.m.
Right. Why aren't you though?
Man, listen.
What you be doing?
Be honest. I'm trying to work on different things. Social media, storytelling for my Black health community.
Yeah.
Or sometimes with work. Work can keep me into some late hours. But then I'm also trying to just watch that Netflix movie with my wife. We're catching up with her. She has a long day of work. And sometimes she's up doing her notes right after the office. And so, I challenge myself, even with this talking. I want us to all do better in taking control of our health, because it's when we assume that we have it all together, that's when the worst can happen. Let's not assume. Let's look at the facts. Let's not just feel. Let's look at the facts, and let's say, hey, especially as a Black man, I have to take control of my health, because if not me, who? And if not now, when?
You also got to keep in mind, right? Like, again, going back to the point of leadership, right? So you mentioned something that I found very interesting, because it's kind of similar in my relationship, where you talked about, like, okay, also my wife, she's up at that time as well, right? Okay. When you have a partner that is doing a certain thing, you are more likely to then do that thing as well. Regardless if we're the leader or they're the lead, whatever the case may be, right? So you got to be very, especially as a man, because we're supposed to be the ones leading in most facets, right? You got to be very, very careful with the habits that you create inside of your family, because your family then takes on those habits as well.
Correct.
And if you mention like sleep is that important and you're not getting sleep, then she's not getting sleep. You get what I'm saying? Like, it's creating a habit of like, no sleep. This is a fan. We don't sleep out here.
Team no sleep.
Team no sleep, which is like team silent illnesses.
Right.
You get what I'm saying? Like, that's not where you want to be. Right. So like, I just, like, I'm really challenging you. I know you got a lot of stuff going on. Right. But bro, like, if you know this is a thing, bro, please. And this is out of love. Like, this is not, like, F the podcast, bro. Like, for real, this is out of love. Like, bro, figure it out. And I'm saying this as someone, not just someone that, like, I'm not saying this from the outside looking in. I was there with you. When I was building Express Yourself Black Man, bro, there was a lot of nights I was up till 1. Naeem and I were doing long distance then. So it was easier, because, like,
you did long distance too?
Yeah, we did. Oh, okay, dope, right? So we were doing long distance where it was like, yo, she would be up until like 10, then she'll fall asleep. Then I'm 10 to 1, I'm doing stuff. When we start seeing each other, I found myself, the only time I would get sleep is when I was with Naima. I would visit Naima for like a month just to spend some time. And I'll be going to sleep at like 10 p.m. I'm like, I used to tell myself I can't sleep at 10.
Right.
But I'm sleeping at 10 at 10, sleeping beautifully. Great sleep.
Right.
So now I'm realizing, like, yo, I'm lying to myself. I can go to sleep at this time. I'm choosing not to. You know what I'm saying? So it's like, yo, it's just the choices, bro. And I'm telling you this, I'm going to round it up and let you say it and let you respond. I'm telling you this to say this right. Like, bro, I promise you, whatever the hell you're working on is going to be there in the morning.
Right.
You know what I'm saying? Write the idea down, whatever it is that you have, set an alarm, and then get you a sleep routine too. Like, at certain times, you got to know, like, all right, this is what I'm doing to prepare myself to go to sleep. Because if not, you're going to stay up.
Yes.
You're gonna stay up. It's too easy, especially when you got all this stuff going on, bro. You're a director. You got entrepreneurship stuff that you got going on. You got a wife. Yes. You're a doctor. You got family.
Yeah.
You know what I'm saying? And if you don't develop it now, especially when you add kids into it, bro.
Man.
What? Bruh. So I'm just saying all that to say, bro, like, the habits that you create are going to impact the people around you.
Fact.
And that's the responsibility that we have to bear as men. Yeah. So we got to be very mindful of the ones that we create, especially around like lifestyle stuff, you know, like, cause that's going to impact everybody. But I know you wanted to say something, bro.
No, I see. You just said it perfectly.
Yeah.
I was excited because you talked about sleep habits. So I was actually going to bring up, you know, another thing with Black men, right? Sometimes we know what to do. We just don't do it. And that's what I wanted to talk about because I know what to do.
Yeah, you don't need me to.
I went to school for it, man. I know what to do, and I'm not doing it.
Right.
And so it's one of those things. It's like, yeah, sleep habits, proper sleep routine, sleep hygiene. That's what they call it, sleep hygiene.
Yeah.
Making sure that you have all the tools needed to truly. Can you fall asleep well? Do you have a pattern? Do you take a shower before bed, or do you use any, calming sounds? Or sometimes, it may be as simple as having the lights turned off at a certain time. You might not be fully asleep yet, right? Yeah. So all these things that I tell other people or talk to other people about, I'm like, I need to do this for me. And so one of the things actually that I started doing, because you'd be proud of me, because I know you said, you need to work on it, my guy. I started this last night. I said, you know what? I'm going to try these things. I got on Amazon. They call like shower.
Is it a bath bomb or something like that?
Not like a bath bomb, but it's like a small disc, right? You put it in the shower and shower steamer. It's called a shower steamer.
Okay.
You put it in the shower.
Yeah.
Lavender.
Ooh.
Aromatherapy just creates
an environment.
Create that environment. I put some acoustic sounds on, something that's chill, and I just have my shower, man.
Yeah.
After my shower, I get out. And, my old routine was like, all right, I got to catch up with my socials, got to start planning things for the next day.
Yeah.
What's my work schedule, calendar looking like?
Yeah.
What messages I have to reply to?
Yeah.
Now it's like, I still do it, but I time myself. I'll put a timer on. I'm like, okay, after 30 minutes, I am going to bed.
Yeah.
If I am not in bed by this time, that's a problem for me. Because I need to, have that small progress. And that's the thing too. For people who might feel like, hey, this is a big ask. I need to go to bed by midnight because I have so much to do. Try going to bed even 15 minutes earlier every night, because that's exactly what I'm doing.
I like that.
So I started
incremental progress.
Yeah. I started at 12:30, 1:30.
Yeah.
Now I've gotten it to 12.
Yeah.
12:15. My goal is to get it down to 11:30, 11:15, and then I might stop around 11. I don't think I can do a 10:45, 10:30, but I could start maybe the process a little earlier, winding down around 10:30 and seeing how that goes. But, I just wanted to say a lot of us know what to do.
Yeah.
But we don't do it. So
I think about this like how I think about diet in a sense. So here's what I mean by that. Okay. Again, I used to go to sleep at 1 sometimes.
Okay.
That used to be my sleep schedule. I used to literally go to sleep at 12, 1.
Right.
And then I wake up at 5 to go to the gym. And I would be dead tired. I would then get back from the gym and I would start my work day and I would be falling asleep at 9 a.m. You know what I'm saying? And so I realized, okay, I have a problem. So then I started changing, and eventually I got to the point 11:30, 11, 10:30, 11 is where I'm at right now, right?
Okay.
I still have my days sometimes where I'm like, you know what, effing, I'm going to stay up till 12.
Yeah.
Same thing with your diet.
Yeah.
You realize most days you got to eat right. But on a Friday,
come on,
I'm gonna have a little pizza.
It's the weekend.
Give me a little cake, a cupcake, whatever. You can still have your days where, you know what, I'm gonna get some stuff done this night. But most days you got to make sure you get your sleep. And then I wanted to say this too, because it came to me one of the things that I did that I think helped as well, I started setting sleep alarms. So, we all have an alarm to wake up. Nobody has an alarm to go to sleep, right? So I started setting sleep alarms where it was 10:30, my alarm would go off. So it would remind me bro, you got, it's time to prepare to go to sleep. Then 11, my alarm goes off again. So this is the alarm that's bro, listen, you playing now. right? 11:30, if my alarm is off and I'm not in bed, I'm bugging out. Right? Like I know like I'm wilding. Like, so that helped to remind me like, okay, it's time for you to actually start preparing yourself to go to sleep. Cause like I told you, bro, I was someone that was going to sleep religiously around like 12:31.
Right.
And what I realized is throughout the day, I would be falling asleep throughout the day. I'm not able to really be cognizant of what's going on around me. And then some of us, even if we're able to like actually focus, we don't realize that we're actually operating out of sleep deprivation.
Yes.
But it's become so normal for us that it's like, okay, cool. This is how I normally operate. I dare you to go get a week's worth of good sleep and then tell me that the last week's version of you that was sleep deprived is the same version of you when you get 7 to 8 hours of sleep. There's no way. There's no way. Because once I started getting 7, 8 hours of sleep, and I started actually going throughout the day and like doing the things that I was normally doing, I realized like, damn, I'm actually more attentive. My ideas are coming to me quicker. I'm not stuttering through things. It's not hard for me to come up with new concepts and ideas and send emails. I'm not getting decision fatigue earlier in the day because my brain actually has the capacity to work on these things because I'm not sleep deprived. But when you're sleep deprived, you have like half of what you normally would have. But if you've been operating at half for months, it feels like the full. Because you haven't had full in so long. So I challenge brothers that are listening to this, women, whoever, like if you feel like you're not getting enough sleep, but you're used to that, I challenge you to actually get enough sleep. Get your 7, 8 hours in. And then tell me what the difference is. And if you're one of those people that's not really able to do it, if you're like, yo, there's no way I can get my sleep in, you got to take naps.
Right.
Because again, there's alternatives, like you talked about. Different approaches for different people for the same thing. Naps are one of the things that I started doing too, bro. I was like, yo, I need to take me a nap, bro. Again, I used to be tired at like 9 a.m., 10 a.m. I'm like, bro, why am I trying to force myself to stay up?
Right.
I can't even read an email without drawing. I might as well just go fall asleep real quick. Let me go take a nap. I took a nap for like an hour one time. And I woke up. And like when you wake up from an hour nap, it's weird. Initially, you're like, bro, what the fuck am I doing up? I might as well just keep sleeping. Then when you get up and you actually start paying attention to stuff, like it takes me like 5 minutes to really get into my groove. I'm like, damn, like I got so much more energy. You feel so much more energized than where you were before you fell asleep. So like, bro, naps were like very crucial for me at one point. And even to this day, I still would take a nap. If I feel like I need to take a nap, I'm going to go fall right asleep, bro.
Take that nap. And I just want to hop in and say, progress, not perfection.
Facts. Please.
Progress, not perfection, because everything you're saying, it is possible for us to do. It's not impossible.
It's not.
But, you know, one of the biggest things that I have seen in friend groups, with my colleagues, professionals, is when we get so caught up in the idea of change, we sometimes scare ourselves out of doing it, out of making it, because it seems like it's such a big deal. Right? That's why, like, for people who are trying to quit bad habits, doing cold turkey sometimes works for a short term, but not long term, because it's so difficult to just drop something. But progress, not perfection. What did you do good today? You know, what were you able to do with your habit that you may not have done yesterday, but you did it today? You know, and I think that kind of thinking really helps align not just with this conversation here, but the broader concept of just taking care of our health and reclaiming our health, right? And making sure that we truly take control of all aspects of it. So.
Yeah, man. So I know you mentioned sleep as one of the things that's like slowly leading to us being ill as black men. Do you have anything else, like any other things that we're doing, like bad habits right now, or habits that we have right now that may be leading to us having negative health outcomes outside of like
so
go ahead.
I don't want to be a parrot here and just repeating
go ahead.
Repeating things, but definitely vocalizing what is the issue with you, or vocalizing what is going on with you. Because, so, you know, my father's from St. Lucia. I have Caribbean people in my family, and a lot of the men My goodness, I'm shaking my head because I'm just thinking about how many times I've seen them go through health problems and they just like don't want to even talk about it. So part of the problem, right? You can't even advocate. We talked about advocating earlier. You can't even advocate for yourself if you're not willing to talk about what it is that's going on with you.
Yeah, that's the first step.
So that is the first step. So that is a barrier, I believe, to a lot of health issues. If more Black men were to talk about what's actually going on with them in the health, I think we would, on a whole, have a new conversational topic to discuss, which then could bring more awareness that makes us willing to advocate for each other as brothers in the community.
Yeah.
So I would say, one thing that we're not doing enough of is just talking about what it is we're going on, whether it's mental health, physical health, and then another thing that we need more of, and we are doing good jobs. This is not to discredit the good work that has been done in the community by brothers. We are doing good jobs of conversating and building community, but we need to build more. And the reason why is because there's going to be another generation that comes after us. And you said this before, where it's like, when I have kids, they're going to look at the habits that I built in my household. The next generation is going to look at the habits that were built in the generation before them. How are we as Black men going to make sure that the next generation feels okay to talk about what's going on with them, feels okay to take control of their health, feels okay to say, hey, listen, I think I might need to really have someone discuss with me what I'm feeling, what I'm going through, what I'm experiencing on a physical, emotional, mental level. So for me, the biggest answer is just anything with communication and communicating your own feelings on your health.
And you talked about every generation learning from the generation before them. It really reminded me of this concept that I have, which is every generation of the Black community should be better than the previous generation.
There you go.
Right? And better is obviously subjective. But when I think about better, I think about you shouldn't have to do the same things that they did. So one of the things that always comes to mind when I think about that is my mom working crazy
hours. Oh my goodness.
Bruh. Yo, my mom, oh my God, thank God she's retired right now, bro.
Man.
It used to stress me out thinking about how much my mom worked. But she worked that much to build a foundation that I could then use to not have to do that.
Right.
If I'm working as much as my mom was working, then something's wrong. I'm doing something wrong, not her. She did what she's supposed to do. I'm personally doing something wrong. That's just me personally. Right. So I always think about that. Again, when we go back to habits, I want to show my kids that, you can be a family man. You can be part of your family. You can nurture. You can protect and provide.
Right.
You can show up and do all the things that you need to do while still being able to financially support yourself, financially support the people around you. Right. You don't have to cut off pieces of yourself to show up as a man in the family, right? To show up as the patriarch in the family, right? You don't have to do all of these things that maybe previous generations would have had to do. Right. I want to show that as an example. And of course, there's going to be things that I do wrong, and there's going to be things that they need to learn from and heal from when it comes to me. But I want to make sure that they have again, when it comes to foundation, right? We think about my mom, my dad. I was able to build on top of that foundation for them to also build on top of the foundation that I build. Right. So I always think about these things because I feel like oftentimes we don't think about how much sacrifice was actually made for us to be in the position that we're in, right? You're 30 years old, you're a director.
Hey,
brother, you're a doctor. You're married to a doctor. Have you ever just stop and think bro, if you look 2 generations past and you're in your family, they probably look at you like, what the?
Yeah.
You're their wildest dream, bro. You're their wildest dream if you really sit and think about it, right? If you really sit and think about it, you're their wildest dream. If I sit and think about my situation and I look at my parents and their parents, I know I'm their wildest dream. For my dad to come immigrate from Ghana.
Yeah. Wow.
To be a U.S. citizen, to then have a son that's able to work and take care of himself and support himself, and now is be traveling around the world with cameras, interviewing people and talking to all these different people, and now it can put that out to hundreds of thousands of, like, it sounds like a movie to them, right?
Yeah.
Right, but these are things that we sometimes can, like, we can be in the moment and understand, but take for granted. So, like, I just want to always, like, bring it back to that, like, yo, again, every generation should be better than the last.
Right.
And that looks different for everybody. But if you're not building on top of the foundation that was already created for you,
right.
Me personally, I feel like I'm doing something wrong. If I have to do the same thing that the previous generation did, I don't feel like I'm doing what I'm supposed to be doing. You know what I'm saying? So I'm always very cognizant of that. And it just reminded me of that when you talked about generations learning from the generations before them, man. Like, yeah. So anyways, back to the conversation, man. I want to ask you, what does it look like for us to have a healthcare system that actually is in tune with what our needs are? Because that's basically what you do at work, right? Like,
yeah.
That's what you kind of advocate for. So what does that look like?
Health equity is so essential and crucial to this conversation because it means, again, that if we are to have a system for us, it needs to be for who we are. It cannot be made for other people, other groups, other cultures. It has to be made for who we are. But even in our own culture, we have differences. And so I think of it as, number one, making sure that we have a system that is culturally appropriate. Let me break that down. Culturally appropriate means that when you are dealing with a patient, a member, you're really understanding that different cultures have different contexts. So one culture, it may be normal for them to have maybe more starchy foods in their diet. Another culture may have more protein in their diet. Is it culturally appropriate for me to go to someone who may be from Nigeria, for instance, like some of my good brothers, and be like, hey, don't ever eat fufu again. Don't even eat jollof again.
Or might get killed, bro.
You might get killed. Or you think it's appropriate for me to go to my Trini brothers and say, no more roti for you, bro.
Yeah.
Or even if I go to any Jamaican and say, no more rice and peas and stew chicken.
Yeah. Right.
Bro, culturally appropriate means I can work with you and figure out how best to keep your culture while keeping your care. So that's one thing that is really important. Another thing is, I always said, like, hey, if you don't find a doctor that listens to you, find another one. But it is okay to sometimes find doctors who look like you because they are sometimes more aligned with your care and your culture. Now, I can't make this a one-size-fit-all statements because not everyone who looks like us is for us.
Yeah.
So that's very important to be stated.
Right.
Not everyone that looks like us is for us. However, with that being said, a system that is to be built for us has to have us in it. Right? It's the same thing with policies. And the same thing with when you think about policies across the states and the nations. Policy doesn't become better until you have people who look like us to make those policies, because guess what? When the change comes, it's going to be more beneficial to a more broader community than just keeping it exclusive to only a certain type of people.
Right, right.
So if you look at those two aspects, I think making sure, again, you are finding your voice in a system that looks like you, and then finding a system that also is built for culturally appropriate care. And that's very relevant to start the conversation about what a system could look like for us.
I like the example of like talking about the foods, man, because like I think that's where we lose a lot of cultures. It's just like when we talk about health, we're saying like, okay, we're saying to like a Jamaican person or a Trinidadian person that you got to give up what you've been eating your whole life. That people from your home that literally still eat that and they're 90 years old. You're telling me that I can't do that? It's not making sense, right? So it's like, you have to be mindful of that, man. Can I ask you a question, brother?
Yes, sir.
Can we get deeper?
Let's get deep.
Okay.
Let's get deep.
So I have a series of questions that I like to ask as part of the podcast because I feel like it's important that when Black men are in a room together, that we have true, honest, vulnerable conversation. And recently, someone from New York passed by suicide. And it made me realize, like, we don't have enough, like, and it's crazy to say this because I know the platform that we built, we don't have enough conversations about depression and like suicide on a podcast. So it's challenged me to make sure that every time I get somebody, that I'm sitting in front of somebody, black man, black woman, whoever, that I have these conversations. And so that's why I asked can we get deeper, right? So the first question I want to ask you, right, is, was there a moment in your life where you ever felt like deeply misunderstood? And I want to give you some time to think about that. And then if there was a moment, like, what was that? And how did you respond to that?
Transparency time. I said again, you know, my parents from the Caribbean. So they moved to New York in early 80s. I was born in Brooklyn. And then we ended up relocating to North Carolina for some time. And that's where I had some of my childhood memories. And my mom was a teacher. So she really made sure that, hey, I want my child to be the best. And education became the theme for my household. So that means Michael's reading a certain amount of books per week. He is carrying himself in a certain light, in a certain manner. He's making sure that he's an advocate for education in the best light possible. Now, because my mom was such an avid educator and such an avid, you know, force when it comes to supporting me, I had a little bit of a speed start in school. So I was 9 years old in the 6th grade.
Oh.
9 years old in middle school.
Yeah.
Now I'm even saying it out loud. I'm just like, that sounds kind of crazy.
Yeah.
I didn't fit in. Let's be real. I didn't fit in. I got bullied, thrown into trash cans, punched, beat up like on the regular. And then I really started feeling like I'm really just trying to be a good guy, nice kid, but people don't understand me. You know, they don't understand the fact that where I wasn't because I was trying to be a show off or show out. It's just I was raised in a certain household where education was the reason I was here, and I'm just trying to make it through like you. But, you know, kids can sometimes be mean. Kids can sometimes be not so understanding. So, yeah, I started around 6th grade, and then it just went to high school because I was always the youngest. I mean, I graduated high school when I was about, I think I was 16. Graduating high school, and I started college at 16 the following semester. So just like I had always been the youngest, and it was so difficult for me.
Yeah.
Because I never fit in. I just never fit in. And also like how I dressed. Like I looked like, you know, 90s kid, tucked in pants, high belt, you know, always had the polo shirt, glasses. So it was very easy for me to be a target. So I don't think I actually was understood until I understood me. And
explain that, yeah.
And let me break that down. So during the time that I was bullied and, you know, all this stuff was happening, I found myself trying to get validation from others because I needed to fit in, because I needed to stop getting made fun of, right? And it's not until I got to college, 16 years old, going to college, and then I'm like, I could just be me. And I made more friends and had more people just accept who I was once I started to rock with it. And I'll give you an example. People would make fun of me. I get sad or whatever. People make fun of me. I roll with it. I started rolling with it. I started like, oh yeah, that's who I am. That's how I do. I started embracing more of myself. And I realized I didn't really embrace myself as much as I could have when I was younger.
Yeah.
And so some of being misunderstood and just kind of like that you know, trajectory of being misunderstood, I feel like I could have taken a little bit more of that control.
Yeah.
Because the truth of the matter is, if people misunderstand you, sometimes they're just not for you.
Yeah.
But I chose to still try to fit in and try to, you know, I mean, there's only so much you could do as a student where you have your classmates, but I felt a lot more empowered when I just, got into college. I was still young, but I still took a little bit more control in just saying, yeah, this is who I am. And then I figured out who I really am, just my own style, my own way of still being the smart, cool kid, to a degree.
Yeah, yeah. No, I love that, man. I love that. So I feel like, no, go ahead, continue.
No, that's pretty much where the story ends, in the sense that I just embraced a little bit more of who I was. And I realized, like, when I think about my childhood memories where those things did happen, I'm like, I'm sad that it did happen, but at the same time, what would have happened if I didn't really have those experiences? Who would I be today?
Right.
I feel much more confident in who I am today because I've just, who you see is who you get, and here I am. But I think this is just a testament of sometimes when you are misunderstood, you have to ask yourself, like, why? Why am I being misunderstood? Because if it's because you're trying to, maybe you don't fit in already, but you're still trying to fit in time and time again, sometimes it's okay to fit out. You don't have to fit in.
Mm-hmm.
And again, like, being a younger kid, it was hard for me to even understand this concept. But now that I'm older, I can be different. That's cool.
Mm-hmm.
No problem.
And it's not even being different, it's being you, bro.
Being you.
You know what I'm saying? Being unique to who you are and not trying to fit in because why? What's the point?
Yeah.
Man, when I was in college, people didn't think I was weird, but for lack of better words, people thought I was weird, right? Because I was a kid that was in college that, like, wow, I was at the HBCU, so it was lit.
Yeah.
Right? Everybody's going out, right. We dormant, we were away from our parents.
Right.
And I was on something like, yo, bro, like, I'm trying to study. I'm a computer science major. I don't know what y'all talking about. Like, party where? I'm trying to get these books, bro. That's what I'm here for. Like, that's how I get this return on investment. And I don't understand why y'all skipping class. I used to get upset. I still to this day sometimes get upset. Just think about, like, yo, people skipping class. Like, you skipping classes?
Right.
I used to talk to people that was skipping class. I used to be like, bro, you're an idiot. Because you're paying, like, you're literally paying for that class.
Yeah.
I used to tell them, like, bro, would you throw away $500? No, I wouldn't throw. Bro, that's what you're doing right now. You're skipping a class that you're paying for. The university wins.
Right.
They're still going to get the money. You already paid them.
Right.
You still got to pay that loan back on whatever interest percent you have, whatever the case may be. You probably have to pay even more than what the classes were when you really think about it. So why are we skipping classes? That used to be me. People used to hate me. People used to hate having that conversation because they knew that that's what my thought process was. Yeah. So, like, I used to be the person that people were like, yo, bro, like, man, this guy, he too uptight. You going, when you graduate, you going to be upset that you ain't take. I'm still waiting. I'm still waiting to be upset. Because everything that I did in college allowed me to get to where I am today. Allowed me to be who I am today, to be in the position that I'm in today. Like, to set myself up so that I can, again, when we think about foundation, build on top of that foundation. That was always in my mind, like, yo, bro, I'm not here to play around. Like, don't get me wrong, I'm gonna have friends and we gonna go out and do stuff and all that. I'm not the type of person that was, like, super antisocial and stuff. Right. But, like, bro, I'm keeping the main thing. I'm focused. I'm not trying to be on some, let's go out and party every day. Some people can do that and still do what they need to do. I wasn't that person. Again, knowing yourself. I wasn't that person. Right. If I'm focused on something, I get hyper focused. That's how I was able to build Express Yourself Black Man, because I get hyper focused.
Yeah.
Like a tunnel inside of a tunnel inside of a tunnel. I get nested tunnel vision. Like, I'm real focused. So I'm not trying to play games and go out and do, Weekends is for studying and getting right and prepare for the next week. It ain't to relax and have fun and do it, like, bro. So that's my thought process was always, man. So, like, I can completely understand what you're talking about, because I used to have moments where I used to think to myself, like, bro, are you going to regret this? Are you being too serious? Are you too, like, stuck up? And I think to myself now, I'm so grateful for the younger version of myself that was stuck up, that was not going out, that was super focused, that was studying, that didn't want to party and do anything, because he allowed me to get here. And I was very misunderstood in those moments. People used to be like, yo, bro, you bugging. Like, what's wrong with you?
Right. Yep.
You bugging, what's wrong? Like, nah, bro, you bugging. You gotta get to a point where you realize, like, no, if somebody's telling you that you're bugging, they might be the ones that's actually bugging. Nobody that's built anything that's like memorable or like successful has never had anybody like this. All the people that have built things that are successful have always had somebody that's told them that they're bugging. Anybody that's built something that they're like really proud of has had someone at some point in their life tell them, you're wilding.
Right.
You're bugging out. I've had it with this platform. I've had it when I was in college. I've had it before that. Anytime you set out to do anything extraordinary, you're going to have people that are in their ordinary elements that are telling you what you're doing is extraordinary, for lack of better words. That's what they're saying when they're saying you're bugging.
Right.
So you have to acknowledge that, yo, you know what? If I'm trying to set myself up to change the trajectory of my family's life, it is not going to make sense to people that are cool with where they are.
Yeah.
And it's not to be disrespectful, but that's really I had to get to that point, that realization, because I used to get so upset.
Right.
Like, what's wrong with this person? Not realizing, like, bro, they're not supposed to get it. God gave you a vision. He gave you a path. It's not for everybody.
It's not.
You can't explain the path that you're on to people that are on a different path. It don't make sense. You got whole different obstacles and things that's how God set stuff up. Master orchestrator, master strategist. I'll never be able to, I sometimes don't even understand it. How the hell you expect somebody else to understand?
That's so true. Man. Like, what is for you is for you.
Facts.
You cannot, no one can live on your path. You cannot live on someone else's path. So you cannot, it's funny you say that, because like, you can't, you talked about how you get upset sometimes, but at some point we have to be like, you know what? It's not even worth getting upset at, because truth is, they just don't understand. They just don't understand. And that's okay.
Yeah.
Right? And then from there, you just keep doing your thing, because you mentioned how, studying, that was also me.
Yeah.
I'd be studying a lot. And even when I tried to have a social life, it wasn't really social in college. It was like, yeah, I'll meet you in the cafeteria, or I play the piano, so I might do like a music jam session with my friends.
Yeah.
Every now and then we did like a Call of Duty tournament or 2K and 2K tournament. But for the most part, I was in my classes. I was getting my reading in.
Yeah.
And people were just like, why aren't you just chilling and having loosening up? But things like that, as you said, kind of lead to who we are today.
Right.
Because what would have happened if we had done
the opposite?
Yeah. And it's not to shame anyone who might be more social, might be extroverted, but it's to say, like, if you have a path, don't change your path to fit on someone else's. Don't fit your path to fit on someone else's.
That's a fact, bro. I think, again, everybody sees things from their lens and their path.
Right.
So even when we talk about this from our perspective, like, if it worked, this is why I always say, if it's working for them, all power to you. I just knew, me personally, I'm not the guy that can go to a party Saturday or Sunday, then get back on Monday and get right for this. Nah, I need my Saturday and Sunday to get right for the week.
Yeah.
I got a plan. I'm a person that, like, I plan, bro. When I tell you I plan, I got a plan for a plan for a plan. I'm telling you, right?
Yeah.
Beyonce will tell you. Like, she knows. Right? So, like, bro, I need my days to plan.
You say your what? Your fiance?
My fiance. Oh, listen. That's a plan right there, brother.
There you go.
I say, oh, come on now. We talking. I know you know. You're a married man. But nah, listen, man. Like, yo, I got a plan for a plan, bro. And so, like, I need my days to plan.
Yeah.
When you telling me I'm going to take a day to go party.
Right.
Bruh, I'm trying to get us financially free. That takes years of planning. Intentional planning, and then years of intentional execution and pivoting. And bro, I don't got time for that. Not to say that we're not going to go to a party here and there and enjoy ourselves and blah, blah, blah.
Right.
Nothing wrong with that. Right. But if that's the majority of what I'm doing, something ain't right for me
Correct.
personally.
Correct.
Again, some other people might be able to do it. Me personally, I need my days, bro. I need my days. I want to ask you, bro.
Yep.
So we talked about you being misunderstood. We talked about how, you know, that manifested.
Right.
Did you ever feel resentment towards your parents? Did you ever feel like, yo, y'all.
Why you have to ask me that question? Why'd you have to ask me that question? I'm gonna just take off this little mic and then walk right out. I will walk right out. My goodness.
Talk to me, brother. And have you had this conversation with them or no? I feel like since they're Caribbean, probably not. Yeah. So if you don't feel comfortable saying it,
I'm here.
Yeah. Okay.
I'm here.
Okay.
I'm also an open book, so it is what it is. Nah. So here's the thing.
Mm-hmm.
Told you my mom was an educator.
Mm-hmm.
She had a firm belief in education, pushing me throughout the best academic rigors of the system, right?
Mm-hmm.
Behind the scenes, boy, and mama, I love you. So this is just my truth. I still love you though. Wake up at 5 o'clock every morning for my whole childhood. Okay. You asked. I'm telling. Woke up at 5 o'clock every morning. We did family worship. So, you know, we start the day in prayer, family worship, and then I prepare for school. And then, you know, I just had to make sure that my work was on top of, even though I did my work the night before, you know, got to make sure I'm the sharpest and the best. And I did this from young until I went to college. It's probably why I always joke, like, I don't think I got my growth spurt because I was so busy studying. But nah, like in terms of resentment, I did resent the fact that sometimes it felt that the educational components of my life were greater than other aspects of my childhood and what it could have been. I'd never had the theme park summer experience because I was doing reading book competitions. I never had the, you know, let's go out and, you know, maybe we do like a week vacation. I didn't experience a week vacation until with my wife recently, you know, understanding what that will be like. And, you know, it's not to say that my mother was very too aggressive on the educational components, but it's just the balance that what I feel like I could have had, I did not necessarily have. Now she did a great job, you know, making sure that I did have fun. It's not like, I'm not saying that I didn't have fun at all, because I definitely had some fun in my childhood, but there were just some aspects of rigorous routine that made me feel, upon reflection, I know I had a childhood, but man, there's some things that I just didn't even know I could enjoy until I'm older.
Yeah.
You know, and so the resentment is just more so like, I feel like I could have had a better, not even better, that's not the word to use, but I feel like I could have lived a little bit more in my childhood. Because you could ask any of my friends that grew up with me in Johnston County, North Carolina. You can literally ask them, what was Michael doing on any given day? He was studying, or he was doing something scholastic, something of academic rigor. And, you know, I think what my mom did instill in me, I have that appreciation for knowledge. I have that appreciation for truth. I have that appreciation for discernment and wisdom and seeking, you know, that which is true. But I know that, you know, one thing we talked about, you know, before, again, you know, families and what my future family would be like. And I feel like I want my future family to be balanced or all angles where, you know, education for me is still, my backbone is still a rock, but also making sure that, you know, I don't get too carried away where education is just the always, and I can't, you know, do something that might be a little bit more uplifting for your childhood experience, that making more memories, you know? And, you know, it's just a thing. I mean, my grandfather, my mom's father, was also an educator, and that's kind of like how he was. So it's understandable of how, you know, I went through the same systems. Would I have changed everything? No. I am who I am because of my mother and my upbringing, and my father too. You know, they did a great job raising me. But I know that even though I was raised a certain way, for the future, there's always a little bit of shift that you can do to make the outcome more palatable.
Yeah.
You know, it's all about making the outcome more palatable.
Yeah. And the thing is too, bro, right? Like you get to choose how you want to parent your child.
Right.
And again, as a man, as a leader in your household, right? You get to set some of the habits and routines around what is normal for your child, for your lady, right? For just everybody, right? So you get to make whatever reality you want to make.
That's true.
You know what I'm saying? And then you get to deal with the repercussions of that reality, right? So like,
but you could adjust,
right? And you get to adjust too, bro. So like, I'm sure you'll find a balance that works for you while still being able to develop a child that is intelligent and knows what they want to do. Like that's my main thing, man. Like,
right.
I'm gonna be honest with you, bro. Like when I think about having a kid, and I want to have two. I want to have a boy and a girl.
Okay.
When I think about having kids, I'm like, bro, I just don't want my kid to be an idiot. You know, like that's the number one thing I think about. I'm sorry. I hate the way it sounds, but again, I'm being real. I don't want to have a kid and then they grow up and I'm looking at them like, bruh,
like what
the are you doing, bro?
What did I create?
Right. Like, yo, like for real, bro. Like that's a real fear that I have.
Yeah.
And I'm glad you talked about your experience of like the academic rigor. Yeah. Because it made me realize like, yo, I don't want to put so much routine in that then I also make my child like not able to experience their childhood. So there really is a fine line, a delicate balance that you have to get to. And every child is going to be different. Right. And you're going to mess up and you may be over-indexed in one area, sometimes and under-indexed in others, right? But like my main thing is that if at the end of all of that, I can look at my child and be like, all right, you are not an idiot. You know what you're doing. You have a good head on your shoulders. You're not only intellectual, but you're street smart as well. Cause sometimes folks be smart, but then you get out on the street with them, you're like, bro, why you moving like that? And you don't even, you don't have no street smart. So like, all these are things that I think about a lot, bro. But, I just feel like it's important to be able to create an environment for a child to be able to succeed. And I've had conversations with therapists and folks on this. And one of the big things that they always talk about is routine. But one of the things you mentioned is just not too much routine sometimes, right? So like, it's going to be a delicate balance, bro.
Delicate balance. Always making sure that if you're doing like too much of anything is not good. Right? Too much of water is not good. Too much of sugar is not good. Too much of anything is not good. And the part of being balanced is just you can be purposeful, but at the same time you can just make sure that every season and every calling has its place in your life. So for this, it means you don't have to get too carried away with any one thing. That was my little story.
Nah, I want to pivot a little bit, bro. I want to ask you another question, bro, from our series. Have you ever experienced depression? Have you ever experienced suicidal ideation? Are you experiencing it now? And then, you know, if you are or have, what was that time like for you? And then why were you experiencing it?
I'm so happy I'm here with you because this podcast, I came here to bless others, and this is actually blessing me.
It's a therapeutic experience.
It's a therapeutic experience. We need more of this, man. But depression, and it's building off the academic stories that I told you before. So, you know, all my life, again, kid that's been just studious, just always the A+ student, valedictorian of my middle school, high school honors. I'm a Gates Millennium Scholar, so the Bill and Melinda Gates Foundation paid for my entire undergraduate and graduate education. So I've been like really blessed. Really, really blessed. And I graduated from college at 19 years old. So the average 19-year-old is getting ready. Either they've started college or they're getting ready for college, or, you know, there's some in between, but I finished
Yeah, I was sophomore year. Yeah, that was me, 19.
Like, I didn't know what to do.
Right.
So I said, you know what? Bet I'm going to come back to North Carolina where my parents were, and I'm just going to continue my education because, again,
education is all you know.
Thank you.
Yeah.
That's all I knew.
Yeah.
I didn't know sports.
Yeah.
I didn't know, some of the other avenues people might take. I just knew education.
Mm.
So, I'm living with my parents, 19,
Mm-hmm.
finished college. And I'm like, hey, maybe I can get into this master's program. At the time, I didn't even really know what I wanted to do. I knew healthcare was always a thing for me. And I had thought about medicine and medical school, but I wasn't really sure.
Yeah.
So I said, you know what? I'm going to just do a master's of physiology.
Okay.
Because the master's of physiology, first of all, you taking all the courses you need to take to get into any healthcare.
Right. So it's safe.
It's not just safe. It's foolproof safe. Like, ain't nobody getting into this and messing it up.
Right.
Like, it's very safe. So I said, all right, no problem. So I get into the program and I meet with the program director, and this was at North Carolina State University. And he says, I'm taking a bet on you, but you really got to tap in because the people in this program are much older and much more focused than any 19-year-old. That's generally speaking. So
they ain't know you, obviously.
Yeah. Well, they were, I was the youngest that they had ever had come be admitted to the Masters of Physiology program. So I said, all right, bet we signed the paperwork. Boom, boom, boom. Man, everything changed because I actually started doing the things that I had never done before. So I started going out.
Oh, really? Okay.
Started having the late nights. Started video gaming until the early hours of the morning. Watching TV just aimlessly. And you could expect that, if you give someone ice cream that never tasted ice cream before, they may get hooked.
Yeah.
They might just get hooked, right?
They might want to eat it for breakfast.
They might want to,
dinner.
and you know what I'm saying?
Yeah.
Breakfast, lunch, and dinner. And so that became my experience. So I remember my first semester, I had coming in with A's, and then I'm getting B's and C's. And these are graduate level courses.
Right.
Now, here's the thing, for people who don't know, in undergrad, you can afford to get a certain amount of C's. In grad school, you cannot. Once your GPA falls below a certain number, you're done. You're donezo. That's it. So I'm here thinking, I can coast through. And then the end of my first semester, I get pulled into the office. Same program director who had admitted me, right, helped me with the admission process. He said, listen, what's going on with you? I'm like, I'm just so caught up in all these extracurriculars, and I am studying though. I am reading, but it's just that, I'm a part of the science club too, and I'm part of this. He's like, I don't know what's going on, but you need to just chill and focus, because if your GPA falls below, I think at the time it was anywhere between a 3.1, 3.2, we're going to have to really put you on academic probation, or he might just have to say bye-bye. I said, no worries, I'm going to tap in. So I remember, yesterday, spring semester, I'm taking high-level biochem, high-level toxicology, high-level physiology. These are all, as I said, graduate, intense graduate-level courses. The people that are in the classes with me, these are future dentists, future doctors, future, healthcare specialists. And again, sometimes you know what you should do, you still don't do it. Long story short, get to the end of my semester, took my final biochemistry class, final exam for toxicology, all these things. And I get my, grades. You remember when you used to wait to get your grades that come in, you go online, refresh Blackboard or whatever.
Yeah.
Where's the final exam grade?
Yeah.
The exam grades did not cut it. And I had actually tried a little bit harder, but I didn't try enough. Well, that was on me. On me. I could have. I really could have done more, but I didn't. And I remember After the grades came through, I got a notice from the university. North Carolina State University wrote me a dismissal letter.
Oh my!
You didn't see this coming? Did you see this coming?
Did. No, I didn't. I didn't. Yeah.
I've never told this story before.
Wow.
Like this.
Okay.
Yeah. So I'm glad to be able to tell it. But I got kicked out of grad school.
Right. Okay.
I got kicked out of school. I got kicked out of a university. And they actually wrote on it like you cannot reapply for like a specified amount of time. And when I looked at that amount of time, I can't recall it, but it was just like, oh wow, listen. They're basically putting it to the point where I'm not gonna see them anytime soon.
Right.
So, you asked, the depression, is that something I've ever experienced? I will say, if I can consider it that is what I felt, because my guy, I was so down and out. I didn't know what to do.
Right.
I was living on campus. Now I got to move off campus. Gates Millennium Scholarship was sponsoring me. Now they're like, what's good? Because your GPA was like a 2.7 and you've had A's your whole life and now you have a 2.7. You might just lose the scholarship. That same scholarship that's supposed to carry you forever, we might have to pull that away from you because you didn't do what you were supposed to do. So let me just say this. Everyone has a different experience in life that can trigger feelings of depression. Sometimes it's situational, sometimes it's environmental. But for me, it was the fact that I had known academia and education my entire life. So for you to take that away from me, it's like taking my identity away.
Yeah.
I did not know who I was in that moment. I remember I was with my bro sitting in the car. Even now, I'm telling the story. It's a visceral feeling for me because I felt speechless. I felt emotionally drained. I felt not just what are my parents going to think about this, but how am I going to navigate?
Right.
Right? Because that's on my transcript now. And anything I do in the future, I'm going to have this GPA following me on top of the fact that I got dismissed on academic grounds of failure at a university. And North Carolina State University is a very prestigious university in the state. They do a lot of engineering. They put a lot of healthcare specialists through different programs that they have. And some of those specialists go on to be great, have great careers and be great people. And so I was sitting with that. So for me, that bout and season of depression was very difficult.
Right.
It lasted for me about 2 to 3 months. A lot of people didn't realize what was going on. So I'd have to go to church. Hey, how you doing? I'm dying inside.
Yeah.
I didn't have a plan. And to be honest, even as I continued my life, I was like, is this going to come back to haunt me in any way? But I think you also asked, how did I kind of navigate?
Yeah, I was just about to ask you, yeah.
So for me, sometimes it's a shift, right? And so I had heard someone in my grad program at the time talk about public health. Public health this, public health that. Public health is going to be the future. Now, this was back, 2014, right? Public health is going to be the future. I'm like, all right. So I said, I still have a love for healthcare. I have a love for helping people. I have a desire. But I need to understand how I can get to that level, continue my education, because for me, education was personal in the sense that I always wanted to have doctor in front of my name.
Right.
I just didn't know what method and what route I would take to get there. But the reason that was important is because I know that once you have certain titles, you have certain opportunities. And I always wanted to have those powerful opportunities of leadership to be able to help my people and help others in ways that may be new or maybe, a different experience. So I did some research, did some praying, did some reflection. And that was the longest summer of my life. And I did a Hail Mary. And Campbell University, they had an interview with me, and they said, hey, listen, you're interested in our Masters of Public Health program. And technically, you don't fit in with the academic requirements. And then I told them this same story that I'm telling you. But I changed it a little bit to make it sound nicer. I said, I had some academic challenges because, I wasn't really sure about what I wanted to do. I just changed the angle.
Mm-hmm.
Wasn't as deep. But long story short, I ended up connecting with some of the officials, and I said, please, just take a chance. Promise you it won't be something you'd regret. That was the end of that. And so what I learned through that process is 3 things. The first thing is I had a corner, so I ended up telling my parents a little bit about this story, but I don't think they even know the full context of like me getting kicked out. I think I just told them like, yeah. I think I just told them like, hey, that's not for me. This master's program is not for me.
Oh, that's the angle you use? Oh.
I use a lot of different angles for different situations, different people. So
yeah.
But my brother Brandon, man, he was my ear.
Okay.
So for a black man in context, having that ear is really important.
Right.
I was able to tell him what I was feeling and to tell him what I was experiencing. If I didn't have my black brother, my gosh, I do not know. Mm-hmm. I don't know how I would have made it because he was the only person that knew every single aspect of this story. So he was able to give me insight. He was able to pour into me and say, hey, you should try this. Hey, don't give up on your goals. Hey, recalibrate. Don't give up. So that's the first thing I said, really important for me to navigate. The second thing is be honest with yourself. Don't lie. Don't have this facade of I can do everything and be everything for everybody, or it's okay for me to go out. It's okay for me to spend my time in different avenues. Focus on what you are called to do. And if you're not sure what you're calling this, take a step back to reflect, because there's nothing more upsetting than wasted time.
Yep.
There's nothing more upsetting than wasted time. Now, it's not to say that you're wasting time in discovery, because if you're discovering work on yourself, that's one thing. But if you're literally just, what you could be doing and should be doing, you're not doing that thing. So I was able to really spend time, learning how to be more honest with myself. And then the third thing I would say is I'm spiritual, so prayer is really important for me.
Okay.
So I prayed to God like I never prayed before. And I said, God, I don't know what it is that you want me to do or who you want me to be in life. Let it be clear. Kid you not, I had applied to so many other programs like Hail Marys. Campbell University is the only one that accepted me. And you know what? This just shows the testament of the shift doesn't start with the situation. Might bring up the context of the problem, but the shift really has to start inside. It's really that internal. Can I take the reign of the situation and make it something that can work for me?
Right.
And in depression, that's hard. It's hard. And so to my black man listening, this is what I would say. Listen, number one, always make sure that you are pouring into yourself. And if you don't feel strong enough, find someone, and that's a brother that will pour into you when you don't feel strong enough to do it. And that's really what took me through. It took me through. If I didn't have that one brother, again, I don't know what I would have done. And then just making sure that you can be. There's a beauty in vulnerability. And the honesty that we can even have in this conversation today, the vulnerability, it speaks volumes to what can be done if more black men were vulnerable and were honest.
Right.
So those are the things I would just say, black brothers always tap into someone. If you don't have someone, find someone.
Right.
Because you just never know when you're going to go through something and you're going to need that support.
Facts.
So.
Have you ever experienced heartbreak?
Yes.
What was that like?
So there's different types. What we talking about the heartbreak when I ordered Lau Mein and the wrong order came out? What kind of heartbreak we talking about? Or like,
heartbreak. What was the first thing that came to your mind when I said, have you ever experienced heartbreak?
We talk about relationship.
Sure. Like let me ask you this way. Yeah. What's been the most significant heartbreak that you've experienced in your lifetime?
Mercy.
He said mercy.
All right. All right. Mm-hmm. So I won't use names.
Okay.
Can't use names.
Don't
use names.
Don't get yourself in trouble.
Won't use names. Mm-hmm. There was a young lady that I really, really cared for.
Okay.
She was social. I'm social. She was like energy. I'm like, I'm all good with energy. And, we just had good conversations. Good conversations. Like, you staying up late, we're still conversating, right? And this is a tough story. So
I'm gonna take your time,
hang
bro.
Hang with me.
Yeah.
And so we built a cool relationship because it actually wasn't just like the romantic, like, hey, I see you, you see me. It was like there were levels of depth to it. Talking about like life experiences, goals, dreams, aspirations, values, character, all that 9 yards. So you start building something that's a little bit stronger. And as time progressed, we started getting closer. And as we got closer, I wasn't at that point of labels of boyfriend and girlfriend, but we had been building up to, I was the only person she was seeing. She was the only person I was seeing. Right. And I thought that, realistically, that's what would come next.
Right.
So I'm like, listen, I'm feeling you, you're feeling me. I have to take this family trip out of the country. When I get back, let's see what's good. Let's see what's good. So I get back. No. Before I even get back, I'm in the country. I'm going back to see my dad's island. It's in St. Lucia, just chilling, relaxing. And while I was there, I got some messages. Like, hey, we need to talk. I'm like, what's good? Won't go too explicit, or how explicit can I go?
You can go explicit if you want, brother.
All right. So I'll just put it like this. She had slept with somebody. And
when?
During my trip.
Oh, she's crazy.
And so
she's crazy, bro.
Yo, when I tell you I had built up a really cool, good relationship with this individual, and I was like, yo. And then she starts giving me the, I don't know if this is going to work. I don't know if we can do this. And I'm like, the past half a year to even longer than that we had known each other, we've been building like crazy.
Yeah.
And then I leave for 3 days. On my third day, this is happening. I'm like, hold up. Wait a minute. The crazy thing is it didn't just happen once. It happened twice.
Brother.
And so at that point,
bro,
I had to really come to, I know.
I'm trying to let you go through your story, bro. But
it's a hard story for me. So, I came back to the country, to the U.S. from St. Lucia at the time. And, St. Lucia was a beautiful island. I had just visited my dad's country, so I was tapping in with my family members, my uncles, my aunties. I'm eating mangoes galore. I'm having a great time, and then I'm dealing with this, and then when I come back stateside, I have to face it. So I was torn. So you talk about heartbreak, I was torn. I learned a lot of lessons.
Right.
But I think the biggest one that I learned was, don't necessarily like do a one-off and say like all black women are bad.
For sure.
All black women, are not loyal, whatever. But just take this to say, hey, listen, who is for you is for you. And that quality will show itself when it's ready. Sometimes God unmasks things to save you from them later. Right? Like if I had gone down certain path, who knows what could have happened. So for me, I mean, yeah, it was definitely a big heartbreak. But listen, I'm glad it happened because I met my beautiful wife. What? So let me just tell the story. Can I tell the story?
Bro, why you asking, bro?
Let me tell the story. So this happened. The story that I just told you, that all took place and ended in what, 2017, I think, like early 2017.
Okay.
I kid you not. A few months later, there was another young lady. I was about to go on a date with her, but she was like, "Yeah, I got homework to do. I can't go." And I'm like, "Bruh, I just drove halfway. Like I just drove halfway, and it's like an hour drive from where I was leaving to where our date was supposed to be." And I'm like, "Now you're telling me you can't go?" So then I pull into this parking lot and I call my cousin, and she was in LA at the time. And so I'm chopping it up with her on Bluetooth, telling her about, hey, I'm going to this thing. And then Chelsea, she's in the passenger seat.
What's your cousin?
With my cousin.
Oh, okay.
And so she's like, hey, you sound like a nice guy, but don't worry. One day you will find the woman who will treat you like how you deserve to be treated. That was in 2017. And then my cousin was like, yo. You know, you got to tap in with her. You got to connect. I'm like, I'm good. Because at the time I was in the DM. I just relocated to the DM.
Cousin is a boy or girl?
Girl, right? Yeah, Joe. And I was I'm in the process of thinking about relocating to the DMV. And I was like, nah, I'm good. You know, because the DMV, I'm starting my life, starting my career, you know. And then, you know, Chelsea was in the Southern California region. But Joe was like, yo, did he tap in yet? And about the fifth time she asked me, I'm like, all right, I'm going to say hello. So I said to Chelsea, like, hey, you know, thanks for bigging me up the other day. Let me, you know, let's stay connected. At that time, Snapchat was popping. So that's all we did. We just Snapchatted.
Yeah.
And she had an interview at Howard University for her residency program.
Okay.
And she hit me up. She was like, yo, I'm coming for this interview. I said, say less. Tell me when you're coming to the airport. I'll pick you up.
Word.
You know, let me know what your itinerary is. I got you. Listen, welcome to my neighborhood.
Let me show you around the neighborhood.
And so, you know, it came to this thing where I picked her and I saw her. I was like, my God is good. And his mercies endure forever. Amen. Amen. So I said, you know.
He said, amen, God, thank you, Lord Jesus.
Yes, man. And so we tapped in from that day and we just stayed connected. But what the most beautiful thing, that our relationship was friendship based. It wasn't like there was romance, there was flirt, but it was friendship based. We really were building. And what I had seen with her that I had never seen with any other young lady is the fact that her qualities spoke so highly. Before, like, she didn't even have to speak. Her qualities, just who she was as a woman, spoke volumes.
What does that mean? Explain.
Character, man. Okay. How you move. For example, just a willingness to for instance, we went on a date. All right, man. I didn't have my wallet.
Oh,
how do you forget your wallet on a date?
You wild out.
I thought I had it. I really did. Because, you know, I'm always phone keys wallet.
Yeah.
You know, phone keys wallet.
Right.
And I'm like, she said, no, I got you. I was like, no. I didn't have the Apple Pay at the time. So I'm like, no. She's like, no, I got you. Oh. I was like, all right.
She didn't even think twice about that.
It was.
Man, nowadays.
Like that. Nowadays, it's about what can you do for me?
Right.
Or just like conversation. You know, it's not about me. She's always talking about like, I want to really help somebody. I have this idea about how I can probably do this so others can benefit. I said, you know, so her character just spoke so many things about her and so much volume. So I just said, you're different. You just got great, amazing qualities. Just not that, but wife-like.
Right.
And in a day and age where it's difficult to find quality people, I said,
you said, I got me one.
And it's funny because I actually told her a few months in, because I know y'all, a lot of ladies now by listening to this, they'll be like, hey, when do you find out When do guys know?
I was going to ask you because I already knew. I'm glad you preempted. Go ahead, brother. Please continue.
When do guys know that the lady is wife material, or like they want to pursue for, marriage?
You know, right away, kind of.
The first date we ever had, I automatically knew, like, I see her in the long term. I didn't necessarily have wife as the stamp. I just knew long term. And then maybe like 2-3 months into talking to each other, I think I had joked like very lightly. I was like, "Oh, you about to be my wifey one day," right? But then maybe 4 or 5 months in, I actually like told her. I sat her down on a couch, and I said, "Listen, you really will be my wife, and I will be your husband." And she was like, "What are you talking about?"
Right.
But we just had a moment because it's like we knew that we were who we were looking for. She was who I was looking for. I was who she was looking for. So, even in that heartbreak story, the outcome was take a step back. But as I said, I'm a believer in God, and God's timing is perfect.
Yeah.
When we try to force things into our own narrative, it doesn't always work out. And sometimes it will work, but it won't be sustainable. So you had to learn to trust the process. And, especially there are people right now, they're trying to figure out who is right for them. That's a whole different conversation, but just trust the process and just know that don't settle for less, because, you're going to end up with worse outcomes that you really wish you didn't take part in. So
no, that's a fact, bro. I'm glad that heartbreak led to you finding your way, bro.
Yeah.
That's a beautiful thing, bro.
Yes.
It's a beautiful thing, man. I think the Bible says, right, he who finds a
good thing finds a good thing.
Right, finds a good thing, bro.
Yes.
And I always used to hear that. And we're not married yet, but that's the plan, right?
Yes, sir.
I always used to hear that and be like, yeah. Now, as a man that's like engaged and getting preparing for marriage, I'm finally understanding what that means, bro. I'm finally understanding what it means to find what it means when the Bible says, "He who finds a wife finds a good thing," bro. Because I have people around me that don't have a wife that or are in a situation where they're with someone that is they're not supposed to be with. That's not their wife. And I see the turmoil that it's creating in their life. Right. And so I just thank God, bro, that when God, I put a caption up when I posted the engagement video. When I posted the engagement photos, I said, I know God loves me because when he created me, he thought of you as well.
Yeah.
And that's how I truly feel, because it's like, bro, like I could be in a situation where I'm with someone that's really is not about me, that doesn't care about me, that's not trying to make my life easier, that's not checking in on me.
Right.
Bro, I know what that feels like.
Right.
So I'm so much more appreciative. When my girl be like, "Do you still love me?" I'm like, yes.
Yes, absolutely.
Bro, yes, because I know what life looks like without you. You know what I'm saying?
Yeah.
Like, bro, so, man, I truly love that it led to you finding your wife, bro. I want to end with this question. This is the last question. This question we always ask every guest.
Okay.
What would you say to the black man that's struggling right now? The man that has a lot of things going on, a lot of things on his mind, he's just struggling. It could be whatever comes to your mind about what his struggle could be, or if you don't even have a struggle, you just want to speak just plainly, whatever you feel like is right for the moment, take your time. This is not like a scripted thing where you got to get it right away. So, whatever you feel like you want to say to the black man that's struggling, don't say it to me, say it to the camera.
Sure.
And then we good to go, bro. But take your time and
So to any black man that is listening to this, first of all, I see you. I see you for who you are. You might be going through something. You might be trying to figure out life. You might be looking for more brothers to tap into their network just to feel like you can have support. But I want to acknowledge the fact that I see you. And the second thing is, because I see you, I want to invite and challenge brothers to find community. And it's not always the easiest thing. So I'm not going to say it like, hey, I can just jump into a community tomorrow, but really understanding what do you have to work with? What tools do you have to work with? So if you're online, what online resources or communities such like this one, Express Yourself Black Man, right? Can you tap into that, and how can you find other brothers? Or offline, do you have, I don't know if you have different hobbies, maybe you can build some relationships there. If you're a gym person, if you're a church person, if you're a volunteering person, they're just ways that we can connect. And we were not meant to be alone. That's the thing. Like, God didn't create us to be alone. We need people, we need community, and we need to build with each other. The next thing I would say is that while you build, vocalize what you're trying to build, because it's when you kind of manifest that I'm trying to build XYZ, you'll find people to connect with. So if you're just like, hey, I want brotherhood that is really focused on mental health, you have that right here. Right? Finding and tapping into resources. Or I want to find maybe a community that really, is able to help me as I'm on a certain career journey. Just being specific with what you want, because it's through specificity and saying the goals out loud and writing them down that when we are in our everyday, we can more readily identify how those goals might be in our lives. And the next thing I would say also is just don't be afraid to talk to each other. Don't be afraid to create that conversation, because, as I've shared before, if it wasn't for some of the men in my life, right, the guys in my life that I could pour into, I really don't know who I would have talked to. Not everything I can talk to my mom about, or, some of my other family members about. It's really my bros that I can tap into. And with that being said, it leads me to another thing. Please do not be afraid to take advantage of that, in the sense that you feel, society has said that I shouldn't say that I need help. Society has said that I have to be the strong one. I'm not allowed to express my feelings. Listen, man, you can express your feelings. Like, literally, this is what the platform is about. You can express your feelings. And part of expressing your feelings is understanding what you're feeling. And sometimes you have to sit with that. Sometimes you have to reflect with that. But I feel like a lot of us feel and we don't say anything about it. And what happens is those feelings just don't get addressed. We sweep them under the rug, and it just leads to worse outcomes. So all the things I said, I see you, and I really want you, if there's just one thing I want you to take away from everything I just said, please do not be afraid to vocalize what you're feeling. There's somebody out there that is willing to listen.
Dr. Michael Forde, can you tell the people where they can find you, how they can support you, anything that you got coming up?
You can support me by connecting with me on Instagram. So that's at Michael H. Forde. I'd love to connect with you. And if you're a Black man that felt inspired by this, please DM me. And, I'd love to reach out and see how we can network and just build together. Community is so important, but that's where you can find me.
My brother, you got anything coming up or no?
I do have a lot of things coming up. Some things I have to say offline.
Okay, I got you.
I will say.
Is there anything they can buy, support, merch?
What's up? The main way to support me is by supporting the community that I'm trying to build, where I tell Black health stories.
Okay.
Both men and women, but making sure that these stories have the ability to just be shared.
Gotcha.
I think that's the greatest way, because like I shared my story about my pre-diabetic and A1C situation. Right. There are people who are dealing with these things every day.
Right.
And I feel like when our voices are shared, that's part of the change. So that's how I would like to tap in.
Man, my brother, this has been a great conversation, man.
For sure.
If you guys enjoyed this, please, for sure, share it with someone. If it made you think of somebody, share it with them. If there's someone that you know that could benefit from this conversation, share with them. If there's someone that wants to learn more about Black men, what we experience and what we talk about, share it with them. And if you're not subscribed already, subscribe, like, leave a review, all the good things. We'll see you in the next one. Dr. Michael Forde, thank you, my brother. Thank you so much for sharing with us, man. For real.
Sure.
Thank you so much for watching this episode. If you are planning an event or you are part of your organization's Black employee group and you are interested in having dope Black mental health professionals or myself come in and do a speaking engagement or a workshop or a keynote address or a panel, please click the link in our bio on Instagram or TikTok, scroll down and click book us for speaking and brand deals and fill out the form available on our website. Once you fill out the form, one of our team members will get back to you about how we can collaborate and create something dope for your organization. This is an unparalleled opportunity. We are currently the largest Black men's mental health platform, and we have a few slots available for our calendar year, and we would love to partner with you to create something dope for your organization if it makes sense for both parties, right? So go to the link in our bio, scroll down, click book us for speaking and brand deals, and fill out that form. If you're not on Instagram, the link should be linked in our description of this episode. And it is also on our website. If you go to expressyourselfblackman.com/speaking-brand-deals. That's expressyourselfblackman.com/speaking-brand-deals. If you are looking for a therapist, a Black therapist, and you've had a hard time finding one, you've jumped from therapist to therapist, or you just don't know how to find a therapist, we are teaching a free webinar. It's completely free, taking you from not knowing how to find a therapist, not knowing where to search for therapists, struggling with finding good therapists for you, not knowing what to look for in therapists, teaching you all of those different things, and also giving you the opportunity at the end of the webinar to be connected with one of our safe haven healers who are Black mental health professionals so that you do not have to go through the struggles of finding a Black therapist alone anymore, right? So if you're interested in that, you want to get connected with a Black mental health professional at the end of the webinar, or you just want to learn how to find a Black therapist by yourself, you can sign up for the free webinar. It's linked in our bio on Instagram and TikTok. You just click that free webinar link once you click the link in our bio and fill out the form. You can also find it on our website at expressyourselfblackman.com/links and fill out the form there for our next webinar session. If you're not interested in any of that, right, but you know someone that may be interested in it, all we ask is that you please share it. If you want some of the merch that we show on the platform all the time, that we're wearing on the platform all the time, you can shop it at shop.expressyourselfblackman.com. And once again, we just want to say thank you so much for watching this episode. Thank you so much for supporting us. Please, if you are on YouTube, leave a like, subscribe, comment. If you're listening to this on an audio platform, please leave a review. It helps us out greatly. Thank you so much for your support. We're wishing you nothing but the best and sending you and your family and your loved ones love and light. Peace.
Sometimes I know you feel like you ain't got nobody to speak to. A shoulder to lean on somebody you could preach to. No, you need to hear it, my brother, I love you. We got way too much to live for.